Friday anatomy quiz. This week we're doing a picture quiz. I'm going to show you 5 pictures and ask you questions based on each picture. I have a great mixture of diagrams and cadaveric specimens to keep it interesting. So grab a pen and let's get to it. Question 1. Can you name this bone? And what is the highlighted section of this bone called? Finally, if you look closely, you can see 2 areas highlighted in pink that provide attachment for 2 ligaments. Can you name the ligaments? And also, could you name the joint that it stabilizes? Question 2. What muscle is shown in this diagram? Which muscle inserts with this muscle and onto where does it insert? And what do these muscles do? Question 3. Which tendon is highlighted in green in this cadaveric specimen? Now, which compartment of the dorsal aspect of the wrist does this tendon pass through? And what is the nerve supply to this muscle? Question 4. What is the name of this muscle? And also, which group of muscles does it belong to? And finally, what is the nerve supply to this muscle and what does it do? Question 5. This is a picture of the bones in the wrist. Now, can you name the 2 bones that are highlighted in pink? Bone 1 and bone 2. Now, which structure attaches to these bones and forms the roof of the carpal tunnel? And finally, which nerve passes through the carpal tunnel? The answers. Question 1. This was in fact the undersurface of the clavicle. The highlighted region was the lateral end of the clavicle, and the 2 structures were the trapezoid ligament and the conoid ligament. Now, these are 2 coricoclavicular ligaments that stabilize the acromioclavicular joint. Question 2. This is the iliacus muscle. Now, this attaches to the lesser trochanter of the femur along with the psoas major muscle. Both of these are powerful flexors of the hip joint. Question 3. The tendon in green is the extensor digiti minimi, which inserts onto the little finger. Now, it passes through the 5th dorsal compartment and it is supplied by the posterior interosseous nerve, which is of course a deep branch of the radial nerve. Question 4 was the rectus femoris. Now, this forms part of the quadriceps group of muscles that extend the knee joint. Now, because rectus femoris actually arises from 2 heads, both from the ilium of the pelvic bones, it has an additional function and it flexes the thigh at the hip joint. All of the quadriceps muscles are supplied by, of course, the femoral nerve. Question 5. The bones in the wrist were the scaphoid and the trapezium. The trapezium, of course, being under the thumb, so that's a nice way to remember that. The flexor retinaculum is the name given to a series of fibres that run horizontally from the scaphoid and the trapezium, and it attaches across here to the hamate and pisiform to form the roof of the carpal tunnel. It is the median nerve that runs in the carpal tunnel, and this can get constricted in this region, causing the carpal tunnel syndrome. Now, this results in numbness over the thumb, the index, the middle and half of the ring finger, and it also causes weakness of the thenar muscles that supply the thumb. So patients often complain that they have a weak grip and they frequently drop things. So how did you do this week? If you liked our quiz, give us a thumbs up and hit subscribe. And remember, it's Friday, so stay funky!
Your anatomy matters.